Hey community, this is Dr. U coming at you, and yesterday I posted a video about red light therapy and I got a lot of questions on it. So I want to go over the laser that I use so you understand what it's all about, and down below I'll leave a link somewhere where you can research if somewhere around where you live has this kind of laser. Okay, so what you're looking at right here is what they call a class 4 cold laser. You can see this is platinum, this is a P4. So these things are not cheap. This little thing that you're looking at right here is $35,000. So these things are not cheap, but they do wonders. And really how this principle really works is it's putting photons deep into the tissues without heating up the tissue. So it's going to increase blood flow, it's going to increase mitochondria, it's going to increase the electron transport chain in the mitochondria. That's how this phototherapy works. It's a red light therapy. This is a class 4. They have class 1, class 2, class 3, and class 4. This is a class 4 laser. So let me show you a little bit more details on the settings. Okay, so if you look at this here, you're going to see a reflection of me. Hi. Okay, so here you're going to see basically, this is me right here. So you got my name right here. And then what we're going to do is we're going to start a new treatment. So let me hit new treatment right here. And I'm going to go to head because I posted the thing about head. So we're going to go to head right here. And then I'm going to hit head again. And then I'm going to do just like say a concussion module. So then I hit module and I'm going to say my head is average size head. So I got an average size head. Let's say I have a chronic concussion problem. So, and my pain, I mean, really when it comes to brain, I don't know if it's really much of a pain thing, but what you're trying to do, my skin tone is fairly white, pale. So this is a 2-minute therapy. So, and then you can see the pulse there where it says peak power, average power, and then frequency. So I'm just going to really do this demo on me so you can see what's going on. Okay, so you do want to wear glasses, right? So the glasses are because the red light therapy can penetrate deep into the eye. So you don't want to shine this in your eye. That would be very, very bad. Okay, we're going to start the treatment. I'm going to select the head. And this is it, and you can see, I'm just going to shine the laser right on here, right? So this is the laser right here. Okay, so I'm just going to do the demonstration right on my forehead here. So it's 2 minutes, and it's just basically like this. It's just this simple. Like this thing is amazing. The technology is super amazing, especially with people that have been damaged. I've had phenomenal success with concussions, Achilles tendon pain, just chronic pain. And this gets deep into the tissue. So I'm not like frying my brain. It's nothing like that. It doesn't kill the brain tissue cells. So it gets deep into the tissue and it penetrates and puts photons back in there. I don't know if you can see it, if you can hear it beeping. If you can hear it beeping, so that's just telling me that it's on. And you just kind of go back and forth like this. And this has a whole bunch of different settings. I have 1 minute in here. This is FDA approved, so you can go and you can Google this. This is FDA approved. I've had really good success with Achilles tendon pain, shoulder pain, tendons, that kind of thing, because it's getting deep, deep, deep into the tissue without, this is the key thing, without heating it up. So it's called cold laser, and this is the technology. And you might feel a little like warmth a little bit on your skin if you press really hard in there. Or if I do it on someone's shoulder, if I do it on someone's shoulder, I'll really push hard into the probe like I'm doing a little trigger point therapy and pushing hard. Sometimes it can warm up a little bit, but the sessions can last anywhere from, it could be as little as 2 minutes, could be as much as 8 minutes. Like if you're doing someone's like glute area, their butt muscles, it's going to take more. You can vary the time. You can vary you can increase the intensity here. Let me just show you real quick. Let me turn it around. So you can see right in here how you can increase you can boost the time, you can boost the power, right? So a lot of things that you can do. Okay, so I'm just going to finish up. I just have 13 seconds. So if someone has a concussion, for example, or they have brain fog, well then you want to do the laser, obviously, but you got to do other things than just the laser. You got to make sure like there's decreased inflammation, all the things I talk about on my website. You can see that the laser is not going on right now. So all the things that you want to do. So it's always a polytherapy approach. I have found success with this therapy actually. And that's why I bought one. So anyway, I hope this helps out a little bit. I know there's a lot of questions on my red light therapy and what I do. So if you have any questions, let me know. Email me. I'm happy to answer any questions. Take care. And this is